This is a place for people to come and get better, but work hard at getting better. And again, it's purpose-built at not convalescence, but that working hard at getting better so they can return to their lives.
This is, it will be the latest and the greatest rehabilitation hospital that we've seen in probably many, many years. So we're excited to bring the technology, the latest in technology, to here at the Mahoning Valley and beyond, as I mentioned. We have state-of-the-art therapy gym. Exoskeleton, I would like to invite you over to see that today, how that works for patients that are debilitated, stroke patients, those patients that, need our motor vehicle accidents. We have a secure TBI unit. So all of those patients will be accepted and cared for at our facility.
Patients can come from anywhere. We have enough patients being served at St. Elizabeth Youngstown in particular to provide the necessary volume to keep this facility busy. And we haven't been able to provide those services in the smaller unit that we operate today. We're actually tripling our capacity to care for those patients, and we're doing it in what's now a purpose-built unit rather than a repurposed inpatient hospital unit. As we move the rehabilitation services from the hospital, we'll be using that space to build a neuroscience intensive care unit. That neuroscience intensive care unit will add to our intensive care capacities, where we already offer surgical intensive care, medical intensive care, and cardiac intensive care. This new neuroscience unit will allow us to expand our services, particularly for the care of the stroke patient.
So LifePoint, we have, with this hospital, 46 hospitals across the country. The vast majority are partnerships like this. So we partner with a local community hospital like Mercy Health here to expand access to rehabilitative care. And what we do is we build brand new hospitals to help provide increased access to inpatient rehabilitation services in the community. With every hospital, we see improvements in the hospital. So we take feedback from our teams as well as the local teams as to what's good with the hospital or not. But we also, during the design phase of the hospital, as we said about making the hospital ready for the communities we serve, we do different things. Usually there's different tweaks based on the patient population here in Youngstown and based on what our partner's doing, Mercy Health in this case. If they have certain programs or certain care that they're providing or specialize in, we like to tweak the hospital to serve that patient population as well. So there are different things that we modify in the building as well as improve upon as we go to each new hospital that we build. Patients
will come here, less than a 21-day length of stay. And we're excited about the rehabilitation that they'll be receiving, and many of them will be walking out of here, and they don't come in walking in. So it's exciting for our team to be able to do that.
It's really in a more of a residential campus type environment than the acute care hospital environment. As we looked at this 11-acre piece of property when we started to work through what it might be, that was really one of the things that we were looking for. We wanted it to be both very, very convenient to the community. We wanted it to be close to St. Elizabeth Youngstown Hospital, but we also wanted it to feel very comfortable, a place where people come to heal rather than a place where your sickness is cared for. I think what is so neat about this facility is it allows people to be cared for in an environment that is much closer to a home environment than a hospital environment, where you have the opportunity to go through those activities of daily living as part of your rehabilitation. We have a purpose-built apartment for people to learn to navigate a home situation. We have a cafeteria that feels much more like someone's dining room might feel at home. And we have outdoor activities that can be offered to individuals here to simulate the outdoor activities that people might participate in when they're back to their normal state of health.
The ability to come in and provide a need like this is really exciting to us. I mean, of course, we don't want to build a hospital that's empty. We want to be able to build a hospital that's going to be full and caring for the community. That's what makes us successful, is to be able to have patients experience our hospital, get better, and then talk to all their friends about the fact that we were the place to go, and they continue to refer to our hospital because of the care that we provide each and every day.